It's Thursday, February 25th. February is African American History Month. And as this month draws to a close, I'd like to briefly recognize two important events in Black history. On this day, in 1870, Hiram R. Revels of Mississippi was sworn in as the first Black U.S. Senator and the first Black member of the U.S. Congress. And on February 25th, 1948, Martin Luther King Jr. was ordained as a Baptist minister. In a few minutes, we'll hear from Dr. Karen Olmstead, SU's Provost and Senior Vice President of Academic Affairs. She's here to discuss current hot topics like spring commencement and upcoming fall semester operations. Karen, thank you for joining us. As always, send your questions via email to stayinformed@salisbury.edu. But first, thank you to our campus community for your diligence as our positivity rates continue to remain under 1%. Please be aware that some other institutions, including sister campuses here in Maryland, have been forced to enact stricter policies, including sequester-in-place orders for residence halls and temporary online classes due to spikes in cases and positive tests. These increases have often been tied to parties or other unapproved student gatherings. Although our testing numbers remain low, please continue to follow health and safety protocols. This includes continuing to practice social distancing and wearing masks. To support mask usage, we are considering additional limitations on eating and drinking in indoor common areas other than designated dining facilities. We realize that COVID fatigue is setting in, but this is not the time to let our guard down, especially with more contagious variants of the virus spreading throughout the country and throughout the world. The new testing policies that SU announced last week will also help keep us safer and in compliance with the University System of Maryland guidelines. Some schools are testing students twice a week. We were able to develop a plan that only requires students to test once per week. Employees who are coming to campus regularly must test every 14 days. The new COVID-19 testing protocols will allow you to maintain access to campus buildings. Students, please schedule your first test for next week if you haven't done so already. You must sign up today in order to choose your own day and time for the test. Otherwise, a day and time will be selected for you. Your scheduled test day and time will remain the same each week, and it should be treated just as if it's part of your class schedule. I also encourage you to fill out the consent form in Gulnet to allow SU to collect testing and vaccine information to better monitor the spread of the virus on our campus. This information helps us to know what percentage of our campus community has been vaccinated, so we can make decisions about loosening restrictions when the time comes. Now, for those of you who are feeling stress or anxiety related to the pandemic, I encourage you to take advantage of the many mental health resources that SU offers. For anyone feeling socially deprived, the Center for Student Involvement and Leadership and the Student Government Association offer a variety of safe, approved social events, both virtually and in person. SU offers virtual cultural and academic events too. I encourage you to find something safe to enjoy with your friends. Okay, at this time, I'd like to turn the briefing over to Provost Olmstead. Karen, what can you tell us about the topics of spring commencement and fall operations?
Thank you, Dr. Wight, for the opportunity to join you here today. For May commencement, we're planning a hybrid celebration of virtual and an in-person component because we're unable to hold commencement in our usual way. Each academic unit, college or school, and the Office of Graduate Studies will hold a virtual event to celebrate their graduates. And these virtual events will include guest speakers and the individual reading of each graduate's name. In addition to the virtual events, the commencement team is planning a tentative in-person grad walk at Seagull Stadium between May 13th and May 16th. And this will be an opportunity for graduates to walk across the stage in their cap and gown, their regalia, and have photo opportunities, but of course under safe conditions. We sincerely hope that public health conditions in May will allow for this in-person grad walk, but we'll have to carefully monitor COVID conditions not only in the local area, but in our multi-state region to make sure it's safe for everyone. We expect to make a final decision about the grad walk component of our hybrid ceremonies by April 15th, and we'll let you know what our plans are. So May graduates, please keep an eye on your email for communications regarding commencement from commencement@salisbury.edu. There'll be details about cap and gowns and regalia, ordering and pickup, and then our plans for the virtual ceremonies, May 13th through the 16th. So that's the plan for commencement in May. Regarding what we're planning for fall, I'd like to echo what President Wight said about our appreciation to the campus community in following safety protocols that we have in place, and that has really allowed us to think more broadly about what we might do next fall under normal operations. I'm happy to report that we're planning to offer about 80% of our sections, either in person or face-to-face or in a hybrid format, and the balance in a remote or online format. And we anticipate that most faculty and staff will be returning to campus as well. Although we're planning for more normal operations in fall 2021, it's possible that we're going to have reduced densities in some courses or in some activities, and it's very likely that we're going to have to maintain many of the things that we do now to keep our campus safe, including mask wearing and a regular testing program. There's a lot we don't know about public health in August when the semester starts, including the level of vaccinations on our campus community. That ties back to the consent form that Dr. Wight talked about. And we don't really know what will be going on with K through 12 schools and many other aspects of life for our campus community. So please stay tuned for any changes that might need to be announced. Certainly, there's still many questions that need to be answered, so as always, the best place to check is the Salisbury University's COVID-19 webpage, and then for commencement, check our commencement webpage as well for the latest information. Thank you, Dr. Wight.
Thank you, Karen, for joining us today. I really appreciate your leadership of academic affairs, especially during the very trying last year that we've been through, and we look forward to the commencement and operations next fall. And thanks for agreeing to stick around to help me answer some questions today. Okay, at this time, we will take any questions you may have. Please send them via email to stayinformed@salisbury.edu. Eli Maudlin, what are people asking about today?
Thanks, Dr. Wight. A lot of questions coming in today. First one, if rates are so low, why are we increasing the testing frequency?
Well, a couple of reasons. First of all, we're increasing the frequency of testing to stay within University System of Maryland guidelines. But also, everybody knows, I think, that the COVID-19 has spawned variants in South Africa and England and all over the world, some of which are much more contagious. And it's very easy for the pandemic to get out of control, even if our rates are low right now. So the increased testing allows us to not only monitor the overall health of our community, but also to catch individual cases as they may arise.
Thank you. And the next question is for Provost Olmstead. Will there be options for students to continue hybrid learning or fully online or remote learning in the fall?
Thanks for that question. I think there will in certain programs that are delivered through online means, but as I said earlier, about 80% of our sections will be face-to-face or hybrid. That's the plan, and we're assuming, though, that conditions will be safe enough for us to be able to do that. As I said, we're keeping a close eye on conditions, and if they're pretty much the same as they are now, what we do on campus wouldn't be any different next fall. We'd probably be more like 45 to 50% of our sections would be face-to-face or hybrid. So we're going to have to make a decision at some point if we're going to change our current plan to be more normal or if we need to stay at what we're doing. And we hope to do that by the mid-June or the third week in June. And we'll clearly communicate that to students who are registered for classes if we need to change the modalities of their courses so that they know what they can expect.
Thank you. And the next two questions are for President Wight. Will tuition be the same next semester for those taking hybrid, virtual, or fully in-person courses?
Yes, for undergraduate students, the tuition for all modalities of the courses will be just the same.
And Dr. Wight, you talked about this before, but could you speak a little bit about students that might qualify for the vaccine through SU?
Sure. Some of our students already qualify for the vaccine as a result of clinical placements where they're working in the health professions on the front lines, or sometimes volunteer work or other ways that they qualify other than just being SU students. But as the vaccine becomes more available, we look forward to the day sometime very soon when all of our students will qualify for getting the vaccine.
Thank you, Dr. Wight. The next two questions are for Provost Olmstead. Dr. Olmstead, what steps would students need to take to make changes to their schedules for the fall?
So we're entering the registration season for next fall, so that's kind of the first step. And then certainly in June, as I said, if we make any changes, we'll let students know. And if we don't make any changes, we'll let students know that as well. Students can always look at their schedule in Navigate or in GoalNet to see what they are registered for if they've forgotten. And also if they consult the student page on our COVID-19 webpage, there's a description of the different modalities and the section numbers that are associated with that. But if this summer, if we do end up changing things and they need some support or they have questions about courses and modalities or their academic program more generally, we're lucky to have our Academic Advising Center staff here all summer. So they're available, can reach out to them with any questions and assistance if you need to change your schedule.
Thank you. And could you talk a little bit about what would happen if a student taking a face-to-face or hybrid course ended up catching COVID or went into quarantine? Will faculty be able to work with those students?
Sure. Unfortunately, that happens sometimes now, just given the pandemic. So our faculty have a lot of experience working with students who are in quarantine or in isolation, and frankly, with students who have other illnesses. We really try and support them. But now, as a result of the pandemic and the increased number of students who are quarantined, I think our faculty have a lot more experience working remotely with students, and certainly technologically, we have a lot more infrastructure. We also have a very close collaboration with Student Affairs in the Office of SU Cares, and they collaborate with faculty on making sure that we can support students who are unable to come to campus for a documented reason. We need to know what the reason is, and SU Cares is a great vehicle to support that.
Thank you, Dr. Olmstead. President Wight, the next two questions are about testing. What would you say to someone that says that the frequency of testing has a mental health impact and has concerns about increased anxiety related to the frequency of the testing?
Well, we certainly understand that this whole situation can create a lot of anxiety, and so that's perfectly understandable. The frequency of testing is just one aspect of that, and what I would say is that the most important thing is to avail yourself of the many resources that we have to support students. Contact SU Cares or Campus Health or the Counseling Center, and let's get you the help that you need to reduce the anxiety.
Thank you, Dr. Wight. And can you talk about why faculty are tested less frequently than students?
Sure. Our experience from last summer and in the fall shows clearly that the rate of positivity among faculty and staff is lower than that of students generally, and the opportunities for transmission on campus are a lot greater for students than for faculty and staff. And so we've decided to test students more frequently so that when those things happen, we can catch the positive cases sooner and get students the help that they need.
Thank you, Dr. Wight. And the last question that we've received this morning is related to athletic events. When will the university make a decision about allowing spectators and fans to attend athletic events?
Well, we've been working on this for some time, and the university health team is now considering the possibility of allowing limited access to fans to the stands for outdoor events. They are They have not issued their advice on this yet, and we're expecting that fairly soon, so stay tuned for a decision.
Thank you, Dr. Wight. Those are all the questions for today.
All right. Thank you, Seagulls. That concludes our briefing for today. Thank you all for continuing to do your part to protect the flock. Goodbye, everyone.